by the Interreg Europe Programme, the EU SHAFE project aims at improving policies and practices in 7 European regions by developing a comprehensive approach to the smart, heritage-friendly environment domain. Due to the project characteristics in terms of work methodology and its main target beneficiary group, the older population, it is clear how the COVID-19 outbreak is negatively affecting both the project activities and the regional partners' work around SHAFE at local level. The project coordinator and 3 partners tell us how the regions are coping with and responding to the global pandemic.
COVID pandemic as critical for the project because it has changed the approach to it at least. The project had a very important element of interaction, networking, meetings face-to-face, with partners, with stakeholders, visualizing experiences on site, assessing the capacity to adapt successful practices from other regions. This part of the face-to-face relationship has been missed. At the local level, Vizcaya has suffered from COVID in a very hard way. There has been a confinement for more than 45 days on the population, a population with a very, very high level of aging. We are responsible, for the administrations of elderly homes, where more than 2,000 elderly people live. They have been and still are our main priority since then. Everything else has remained in a more secondary level. With the new online culture developed, we can work where a few months ago it seems to be impossible. Now we are in a new routine which allows us to move forward with the project without major disruptions for the planned final objectives.
Development Center, the heart of Slovenia, had the first challenge when organizing the second stakeholder group meeting that was planned for April 2020 and was postponed to June after the end of epidemic was declared. We decided to have it in person, so the implementation was uncertain till the end. Also, the project meetings with study visits are now just online without seeing the good practice on the spot, which significantly affects the motivation of stakeholders and their understanding of good practices. We organize the meetings so we follow the COVID-19 restrictions. We prefer to have it in person, so we postpone it and just wait for better conditions. If that is not possible, online meetings are then the solution. We also try to present good practices to our stakeholders on the best possible way and provide them additional information from the good practice holder, which takes more time than seeing it in person.
How does the COVID-19 epidemic influence the work in the project EU SHAFE? It has a big impact for our project work. First of all, my team was reduced because a part was sent to the task force of the ministry. A lot of topics came up, unplanned, and of course very time intense to solve it. How to deal with it? Going digital is the key word. Everything needs to be turned in a digital way. The meetings need to be done at platforms. Newsletters came more and more important, and yeah, it was tough, but I think we did a great learning curve, and I think we are now catching up.
COVID-19 has impacted older people more significantly than any other age group. The most significant impact was seen in nursing homes, where at one stage 60% of all deaths were recorded. The Community Call Forum supported NGOs working in the SHAFE sector to continue their normal service delivery and to take on new service users. Nationally, there is a government shift to support primary health care, avoiding admissions to acute hospitals. As a result of COVID-19, the increased awareness of vulnerable older people in our community has driven an increase in volunteerism. In relation to the EU SHAFE project, in the absence of travel to experience firsthand the many good SHAFE projects across Europe, we here in Louth County Council are focusing on policy research and making efforts to implement change. To this end, we've made a robust submission to the Irish National Consultation on the ERDF ESF funding, highlighting the need to build resilience to demographic change throughout the regional operational programmes. Following on from this, our focus has shifted to national and local policies in an attempt to embed SHAFE principles in as wide an arc as possible.